Okay, guys, another Crooked Spine Show interview with Miss Maria Merlo in South Carolina. She is my expert on thyroid conditions. So, if you've ever been diagnosed with thyroid condition, being told because you're overstressed, overweight, unexplained weight gain, fatigue for one, two, and your doctor says now you have thyroid condition, or you think you might have, what's the medical approach? Medications. Okay, we all know the medications that sometimes people get on thyroid medications, which is a common knowledge now, doesn't really fix the problem. What I want Maria to help us understand is how do we fix a problem, maybe our diet, our lifestyle, even our environment too, and how do we get there? So, Maria, introduce yourself for me if you want. At that point, let's see how you got into this.
Well, as you mentioned, yeah, there is many cases right now of thyroid conditions.
Mm-hmm.
Many are actually not detected because they are maybe slightly subclinical levels, of this thyroid condition. Really, to start with addressing the root causes for thyroid, the first step is really to get a full thyroid panel.
Good.
And this is really tricky because normally when you go to PCPs these days, they only run maybe one or two of the hormones that are involved in all what is the thyroid function. Normally they only test TSH, which actually is not directly a hormone. Thyroid is more like a brain hormone in pituitary gland. And really, to have a full thyroid panel, we want to have other hormones, especially we want to know the levels of T4, free T4, and free T3.
What's the difference between free and non-free? How does that work?
Well, so the gland secretes certain amount of these hormones, especially T4 is mainly produced by the thyroid, and but not all what is secreted is used. Sometimes is attached to what is called a globulin. Depending
Okay,
on the conditions, some part of this substance is used and other part is not utilized.
got it. Okay.
Bound, we say, is bound to these proteins.
Mm-hmm.
And so we really care about the three levels that can be used by the cells. And T4 gets converted to T3. A part is converted in the thyroid, but also by other organs like the liver can help converting to T3. So those are the two hormones that we want to know. But also there's a third one that is not very popular, let's say that way, that is called reverse T3. So
Okay.
reverse T3 is the inactive version of T3,
Okay.
and once it's converted, it is not possible to go back to T3. So that version is not possible to use by the cells. It's gonna stay as inactive. So those are the main hormones. And another important marker to add in a full thyroid panel is the antibodies.
Yeah.
There are two specific antibodies that could help us to tell if there is some autoimmune dynamic,
Good.
what we call um, Hashimoto's or Graves' disease.
Mm-hmm.
And that's what the full thyroid panel tells us. And then once we have this panel, depending on the levels, for example, if we find low levels of T4 and especially low levels of free T3, we can suspect that maybe there are some nutrient deficiencies.
So you're saying low levels of T4 and low levels of T3, both low, correct? Okay.
Yeah, especially free T3, because that's the one that goes to the cells. There
Okay.
is also a T2 levels, but those are intracellular, and there are no testing at this point for that. But at least free T3, we want really to check those. If they are low, is normally what we call hypothyroidism.
Mm-hmm.
And it could be mainly by a nutrient deficiency. These two thyroid hormones, the T4 and the T3, they're practically the same. The only difference is that one is one molecule of or atom of tyrosine and four molecules of iodine, and the other one is three instead of that's why it's called T4, and the other
Mm-hmm.
one is called T3. So you need iodine, you need tyrosine for making these hormones, and also there are other nutrients involved like zinc, like iron. Selenium is very important for having a good absorption and for the iodine.
And Maria, to jump
Mhm.
into it too, part of it, if you're listening to the show right now, is she's going to give us a nutrition handout of thyroid nutrition handout. We'll explain all this stuff too. So you can see the handout afterwards too, correct?
Yeah, it's a free
Mhm.
handout.
Mhm.
We can add the link in
Yep,
the comments.
it's in the
Mhm.
comment shows right now. But I like that you have I like that so far you've showed me the scientific approach to a thyroid condition, not a medical approach where we're just going to medicate after get some results back and see what happens. Like I said, you do the minimum lab testing, so you get the minimal knowledge to minimally understand what kind of condition you have. So you're being more specific with is it free T3, T4? Is it reverse T3? Is it the autoimmune disease? You're checking everything, hopefully ruling things out as well as ruling things in, correct?
Exactly.
Mm-hmm.
And there is a lot of things that we can do before considering even medication. There are many, many things. So really, let's start first by the any nutrient deficiency.
Mm-hmm.
Then the other topic, when you see a lot of reverse T3 and not a low T3, free T3,
Okay. Okay.
then you can start thinking the first, this could happen because of stress.
Ah.
Stress can make this, inactivity of the T3.
So again,
It,
that's gonna be
Mhm.
low T3.
Low T3, high reverse T3.
Got it. Got it. Got it. Okay.
Mhm.
Okay.
It could be for stress or also inflammation.
Okay.
And inflammation, when it is a complex word, but many things can cause inflammation. But I have seen cases where clients have an infection, for example. An
Mm-hmm.
infection will slow down your metabolism. Stress will slow down your metabolism, in few words.
So it almost makes your white blood cells go up also, so allows your body long term to stay in an inflammatory state. And that becomes a
Mhm.
stress state for some people, where it then affects them symptom wise with feeling overly stressed, sometimes anxious, sometimes depressed. So overall body becomes more sensitive to things, correct?
Exactly, yeah. And stress is inflammation is another form
Mhm.
of stress.
That's what I deal with pain. Being a chiropractor myself, I deal with people with chronic pain. I always ask them, "Do you feel stressed? Do you feel like you're anxious? Do you feel?" Because
Mhm.
that becomes the chronic pain from inflammation, especially feeds each other to make them stay in that state.
Exactly.
Yeah,
Mhm.
on the same page, Maria. On the same page. We
Yeah,
are
yeah.
good, good, good. So once you have that reverse T3 and low T and T3 too, what's
Mhm.
the next different variables we can work with?
Well, once we have identified those two, then the third one is identifying the antibodies. If
Hmm.
you have the antibodies, then we are talking about possible or high levels of those antibodies. We are talking about an autoimmune dynamic. So that
Okay.
is taking us to a different protocol. You
Okay.
know, all autoimmune dynamics are practically having the same root causes.
Got it.
It
Okay.
doesn't matter where it is. I mean, really, the thyroid in this case is just the victim of the autoimmune dynamic. Just as MS, the victim is the nerves protection, the sheath, and with other diseases that are autoimmune. And then we have to follow a different protocol.
What I like is that you're taking a step back from, okay, thyroid is a symptom. We're taking one more step back, going, okay, now let's find out what the symptom is, cause
Mhm.
thyroid to become abnormal, abnormally functioning.
Yeah.
Good.
So it really depends. So, and when it is not that complicated, you only see, for example, low levels of T3 and T4. Then I want to investigate more about their levels of RBC zinc,
Okay.
RBC selenium. In some cases, I want to run a 24-hour urine iodine test. Mhm.
Why?
Well, there are so many, especially for iodine. There is so much information, and it's
Mhm,
conflicting. For
mhm,
example, if you go to, let's say, your PCP or an endocrinologist, he would say, you don't need iodine because all the salt in America is iodized. It includes iodine, but that's not always the case. Not everybody is taking that type of salt these
mhm.
days. And on the other hand, you don't want to have a lot of iodine because it's also harming. So I prefer not to guess and test. And
Good.
actually, I found myself I have low iodine.
Mhm.
So that's why I prefer to test. And if it is low, let's just start supplementing.
Well, like you're not guessing it. It's like you rather, like I said, like you're saying, I rather test than guess. Why not? It doesn't
Mhm,
cost a lot more to test, so you know within 24 hours. Okay, is this person? Because the problem is not just are you getting, but also are you absorbing it too in your body,
mhm.
or other things negating it. How dehydrated you are. How high? I mean, hydration is a huge thing too with all that stuff. So how do you know for sure by doing the like you are the scientific approach, testing everything so you know exactly how to help the person get better.
Yeah, exactly. And these are very simple tests, are really not expensive or anything. They're nothing advanced. So yeah, I mean, if we can do it, I think it's a good starting point.
Well, what someone has, for example, what are they going to feel differently versus a low T3, T4, where they're considered by definition hypothyroidism versus a low T3 and a low reverse T3? What's the difference they're going to feel
And I mean, in the diagnosis,
in their symptomatology?
the symptoms, yeah, the symptoms is really it is different from people to people.
Mhm.
So we have a saying in functional medicine: sluggish thyroid, sluggish anything. So
Got it.
you can have some people you will see, and this is very common. The first thing that they're going to have sluggish is their digestive system. They're going to have constipation. That's very, very common with people with hypothyroidism. Another thing they're going to have is just feeling sluggish.
Hmm.
They're going to have fatigue. They're going to have brain fog. Um, so those are
Lethargic.
symptoms. They feel cold. Many people say that the thyroid gland is like the thermostat of the body.
Okay,
So
so
you either feel
coldness.
too cold when you are in the lower end, you are like all like the whole engine is low,
Okay.
and it's cold. So you have more type of those symptoms. But
Mm.
it really varies from people to people.
Does it affect your libido too and your
Yeah,
that way?
it will affect all the reproduction, all the sexual hormones, all are interconnected.
Mhm.
So there is a relationship, of course.
And how would you, in that sense, how would you, or unless you want to go back to what a hyperthyroid is, but is there a different, I guess, recovery through your environment, through your foods, through the supplementation? Different supplementation, is that different, the recovery versus hyperthyroidism versus hypo?
Mhm. Yeah, most of the cases, hyperthyroidism is mainly autoimmune.
Okay.
Is what we call Graves' disease.
Hmm.
And actually, there are some cases of autoimmune disease that can be jumping back and forth between hypo and hyper.
Oh, really?
And
Okay.
this is when you start having some funny numbers, like they don't make sense, like
Okay.
between one or another of the hormones in the panel. It could be because of that, because there is an autoimmune function. So
Yeah,
yeah,
one
mainly hyper is autoimmune in most cases.
and hyper would be a high T3 and high T4, correct?
Yeah, it would be. Yeah, it's not very common, but yeah, it could happen.
How do they test Graves' disease or Hashimoto's? How do they test that?
Mainly by the antibodies.
Okay. Okay.
Uh-huh. And the symptoms. One of the main symptoms from Graves' disease is the bulging eyes. The eyes are like more protruded.
Okay.
That's one of the symptoms. Their skin looks different, like orangey peel, rough skin around the
Yeah.
face.
So they said,
And they're starting losing weight. They're like jittering, anxious
so it's
because
almost,
you are high now, and you
almost
feel
like you're,
poor.
yeah, you're on adrenaline the whole time. Your body
Mhm,
stays in that adrenaline type of state.
mhm.
Wow.
Yeah.
It'll be good for short term, but not all the time.
No, not for all the time. This is, yeah, when it's a permanent condition.
That's not good. That's not good. So
No, not
let's
good.
go over the exactly how do we change now, looking at, you had mentioned supplementation, also some foods too. How do we get more iodine in our, if we are iodine low, how do we get iodine more into our diet?
Well, there are, if you don't want to take like supplements, it's just as simple as increasing the intake of sea vegetables,
Okay.
seaweed. You can add some flavoring to your soups and stews by adding even nori flakes, or there are all these flakes that they give flavor.
Mhm.
That's one way. Also eating more fish, more shellfish, more like shrimp.
More ocean type of fish or shrimp.
Yeah,
Okay.
that will be the approach. And well, if you want, there's also supplements, many supplements with iodine.
Is there
Mhm.
something you need to take with iodine to help the iodine absorb in your body better?
I actually, one of the recommendation is, before increasing iodine, first add selenium. Selenium is kind of protective because
Okay.
the thyroid really works hard. It's like almost like a combustion engine. There's a big chemical reaction, and it actually causes oxidative stress. So selenium somehow protects that. It's kind of like the lube in the reaction.
Mhm.
So first you want to have good levels of selenium,
Okay.
so you avoid maybe some side effects from having more iodine.
Mhm.
So you want to first start with selenium.
That'll kind of give you a true sense of where your
Hmm.
iodine levels are once you get the selenium tested first, correct?
Hmm.
Okay.
Exactly.
Okay. And then what else would you do, for example, besides the selenium and then the iodine? How else would you supplement? You mentioned zinc and things like that. How else would you supplement versus the zinc?
The thing, yeah, you can add also the zinc. That's not a problem.
Okay.
You can add it at the same time if you want. That is okay. Hmm.
And how often would you test your blood, for example, for minerals and vitamins to make sure you are getting enough, make sure your body's self-regulating to make even more, correct?
Yeah, I mean, when somebody comes with, and we do the first full thyroid panel, and we find that they may have a thyroid dysfunction, um, we want to retest everything in at least in 3 months,
Good, good.
because
And
in 3 months everything changes.
well, your
Your
body's
rhythm
self-regulated at
changes.
that point, where now it has a better default state to where
Hmm.
it can actually, okay, now where am I at my body? Does the
Hmm.
body, and so people understand, does the body make iodine?
How the body makes iodine?
Does the body make iodine?
Well, no, you need to
Hmm?
take the iodine. There's no way the body can make it. You need to take it,
That's one
and
thing
then. Hmm.
people need to realize, that it's something you have to take to
Hmm.
make your body then self-regulate. Then your thyroid can actually work at a better state. Then it can actually function on its own properly, correct?
Yeah, it automatically will work once it's raw materials.
Mhm.
Sometimes we forget that our body is just a bunch of biochemical reactions, and they need raw materials. It's just as simple as that.
Good, good.
Hmm.
And I think when people understand that, when you have the raw materials, and our body can function well, or it can function, if you don't have them, it can function abnormally, giving people understand exactly how, again, think from a scientific perspective, how that works. Why does medications not help reset the thyroid?
Because at the end, you are not adding the raw material, could be.
Mm-hmm.
And not only you need that raw material for the thyroid, but you will need it for something else in the body.
Mm-hmm.
And really, I mean, some of the people that I've had that they were previously with the medication, they don't feel better at the end. I mean, if this synthetic form of T4 and T3, they may not go into the intracell level, maybe. Or another case that I have is they give T4, the medication, but they don't give T3, only
Mm.
T4, and that doesn't work because at the end you need a T3 to get into the cells.
But when you give someone that medication, does your thyroid now re-regulate to adjust to working properly or no?
Maybe the problem is we don't know what happens after crossing the cells. We don't
Mm.
know that,
Yeah.
but we know it. We always honor our clients' symptoms. I mean, if they keep saying that they don't feel well, then something is happening,
Mm-hmm. Or something's not happening properly.
or
So
something is not happening exactly.
how do we adjust for that one, right? That's the
Hmm.
biggest thing. And how would activity levels, physical activity, affect the thyroid symptoms?
Well, it is always good to have some movement.
Okay.
It's always good, but one of the activities actually that it doesn't help, unfortunately, when you practice very often, is swimming. I
Okay.
mean, swimming is amazing. It's a fantastic exercise. But the problem is the swimming pools. Most of them they use chlorine
Mhm.
for cleaning and killing any germs, and that actually blocks the thyroid. It doesn't let iodine to be in the formula for T4 and T3.
Okay. Okay.
And we have seen that before. Clients that constantly are doing this type of exercise and they have thyroid issues.
Wow.
Hmm.
That sounds like a good paper to write or something like that. That's great.
Yeah.
What else would block the thyroid? So chlorine or chloride
Hmm.
is that can be in also household products, stuff that you may even put around the house, disinfectant for one too. Is there anything around your house you have to be careful with, or ingredients of what you use around your house that could help deplete your iodine or affect your thyroid too?
Yes, especially bleach.
Mm,
Anything that has chlorine is gonna long term affect your thyroid.
okay.
Also, fluoride that is in the water and is in many toothpaste.
Mhm.
All what is chlorine, fluoride, and bromine are from the same family than iodine. They belong to they call it, I think, halogens.
Okay, halogens, yep.
Uh-huh. And they use the same space. So they, instead of having an iodine in the T4, you're gonna have something else and it's not gonna work. It doesn't go anywhere.
You're getting all this chemistry, organic chemistry, biochemistry in my head all spinning
Mhm.
again from back when I was in college. I'm like, "Ow, my head hurts from all that information." It's great.
Mhm.
Well, it's great that you understand the science behind it to help someone's their health improve by going that extra step to improve their body chemistry, not just treat the symptoms.
Exactly.
Then the body can self-regulate to now the thyroid is functioning better. At that point, okay, now I know what to do. If I'm going to swim every day, I have to take a supplement to make sure my body gets enough. I know when my body's off.
Yeah. And if you can switch to salt water, if you have your own swimming pool,
Mhm.
that's another alternative.
And when someone improves when working with you too, Maria, how do they start feeling better? What's the first things they start to feel, or how's their long-term recovery?
Well, the first thing, normally they can get rapid relief for energy.
Okay.
Fatigue is one of the first one that they will full recovery, and then
Mhm.
it really depends. Um, some may show the hair loss.
Mhm.
Some are getting hair loss. They
As a
can
symptom. Okay.
as a symptom, so that will stop. They will get more energy. Their constipation, there's also a lot of things that we can do for that.
Good. When I like in your thyroid handout, nutrition handout, does that include some of the symptoms that people may feel, or more of the recovery portion, or both?
It has a little bit about explanation about the
Yeah.
thyroid, very brief explanation, and a little note about hypothyroidism,
Mhm.
and that is possible autoimmune dynamic. And then in that handout, mainly it is about which foods work with you, to have a healthy thyroid,
Good.
and which ones that we, are mistakenly considered healthy actually are working against you.
Nice. I like that because you don't want to put something in your body where you're like, yes, I'm good. And all of a sudden, oh, I'm not good. Because you said no. Most people have no idea. So at this handout, we mentioned a couple times already, allows people to understand what's going to help someone recover, but also stay healthy too, correct?
Yeah, and unfortunately, there are a couple misconceptions with healthy foods.
Okay.
I think the clear example are kale, like kale salad and raw broccoli. I mean, they're amazing. Definitely, you want to have them in your diet. But I mean, they are okay if they are cooked. The problem is when they are raw, they have this goitrogen compound that also do not help with the conversion of these thyroid hormones. So once they are cooked, these compounds are gone. They are inactivated.
Good. So the wall, it
Hmm.
almost breaks down the wall so you can't absorb it.
Hmm.
What you should.
Yeah, and I love kale salad, and I was like, oh, okay, but well, you can eat it cooked.
That's great. Anything else for your first show? I shared in the links in the show notes, and I'll put on when I put on YouTube too in the podcast. Your links to your website, your Instagram, your Facebook. I love all your information, but out there every day. You're almost out there every day, asking questions
Mhm.
for people, and also like I said, your handout. Please go to her website and get the handouts. At that point, you have a baseline to work with before you talk to Maria. Hey, what's going on? How do I do this? But I love your testing. It's very scientific versus being more medical, where we're going to look at everything, the full panel, then we'll kind of figure out what's going to work for you. So you're not guessing at anything.
Exactly.
That's great. Great,
Mhm.
great. Anything else I missed for the show today?
No, that's fantastic. Thank you very much. And this part of the thyroid, if
Mhm.
anybody has symptoms with thyroid, like the symptoms that we have mentioned, feeling cold, feeling warm, fatigue,
Hair
brain
loss.
fog, uh, having trouble losing weight or gaining weight,
Mhm.
all those symptoms that could be related to a hormone. We actually have a symptom checker. It's in the website called www.hormonedance.com.
Okay.
And also, we are launching our first online program called Feel Sexy Again, and
Okay.
this is part of the program. We want to help committed women with any possible hormone imbalance, so symptoms with PMS, menopause, the thyroid, stress, fatigue. All these hormones are interconnected, so we are not isolating these hormones. All are connected, so we want to treat them all together. We want to address all the root causes of these hormone imbalances.
Well, a lot of it
And
is you're allowing people to have support group to go, hey, how do I find out more information? How do I get people to connect people that may have issues, and or with you, Maria, too, to help them understand how to treat it naturally versus just running to their doctor desperately looking for help now versus not really fixing the main problem.
yeah, exactly. This is without any possible harmful medications, no birth control pills, no SSRIs or anything like that.
Good,
Because
good,
there
good.
is a lot of things that we can do through lifestyle choices and diet, and also supplements can help.
And tell me the name of the website again for the what would you call it? The
For the symptom checker,
symptom checker, right?
uh-huh.
Symptom
The
check.
symptom checker is www.hormonedance.com.
w.hormonedance.com. Cool, perfect.
Yeah, and
All right.
the online program that we are gonna be launching soon is called www.feelsexyagain.net.
I don't know if
Mhm.
Facebook's going to block me for saying those certain words.
Mhm.
Feel sexy again.
.net.
Feel sexy
So yeah,
again.
anybody who feels like this will be, you know, something for them, we're having right now the VIP list, and soon we will open the program.
We're helping someone, and when I'm looking at the big picture, is someone's been on anxiety medication,
Mhm.
weight loss programs, thyroid medication, obviously, other treatments for their overall symptoms. Their quality of life is going to go from here to way down here.
Mhm.
Their relationship's going to go from here to way down here. How do you get their body, the quality of life, their vitality better, so they can feel better and then get back to what they deserve, a natural, healthy life?
Yeah, there are many things that you can do to regain vitality.
Mm-hmm.
The first one, and really the main one, is really resetting your circadian rhythm. That's
Yeah.
really the main one, which means, during the day we have different hormones coming, like dancing. That's why we call it the hormone dance, because the hormones are actually like dancing. Ones go up, down. So some hormones are in the morning, more type of excitatory hormones, because you wanna, something needs you to wake you up. Otherwise, you will be sleeping forever, right?
Not just caffeine then. Okay, got it.
Yeah, you need something to wake you up and start the day. So we want to have cortisol. Actually, we want to have the highest level of cortisol in the morning, which
Good.
is our stress hormone, with dopamine and all those substances, right?
Mhm.
And then it starts going down, and the ones that come up are more melatonin, GABA, to calm you down, and then you can go to sleep and have a restful sleep.
Mhm.
So that's really what you need to work mainly, you know
You get things in
and
the right time, the right way, and
mhm.
a lot of things not to block it, maybe technology, maybe when you sleep off different times here and there, correct?
Exactly, and that's technology. It is one of the points from sleep hygiene. You
Mhm.
shouldn't have any blue lights in the last 2 hours before going to sleep,
Screen
because
time, yeah, screen
screen
time.
time, because it keeps you, like overstimulated sometimes, and that doesn't help you
Well,
going
someone said that it
to sleep.
drops your melatonin, so at that point
Mhm.
your body doesn't know to go to sleep because now you have less melatonin in your body. That hormone doesn't help your body actually get the rest it needs.
Yeah.
Wow. Well, Well, good, good, good. I think you gave us a lot of information for the show. I learned a lot, and I did download your thyroid nutrition handout. Phenomenal.
Mhm.
I love it. It's something to
Mhm.
where if someone comes in with, okay, now I can see someone as a chiropractor, someone's overall health well-being. Okay, maybe you should check this because now I know what symptoms are like feeling cold, hair loss, weight gain, weight loss for one, two things that haven't worked in the past. Why are you still on medications if it's not working for you? This gives someone an
Exactly.
opportunity now to get healthy without the medications.
Mhm.
Great. All right. Well, Maria, one last thing I ask people to do. Quick smile for the camera.
Mhm.
I'll use that picture as our backdrop for the YouTube and also Facebook and
Mhm.
the podcast episode. Thank you for watching, guys. Appreciate it. Hang out for 1 second. Maria, I'm gonna end this show.
Perfect. Thank you.